Welcome to Bringing Better Health to Life, brought to you by Conway Medical Center. My guest is from Coastal Orthopedic. He is none other than Dr. Stewart Haskin, and you have been around a long time.
Definitely, 1983.
Let's talk about how you got to Conway, and then tell me a little bit about your background.
Well, my wife and I moved to Conway in 1983, both of us having met in medical school in Charleston. She is an anesthesiologist, as a matter of fact, is the head of anesthesia at Conway Medical Center and has been for the last 28 years. Both of us are born and bred in South Carolina and met in medical school, and Conway particularly needed an anesthesiologist. So they recruited me only because they were recruiting my wife is the main reason. But we came in 1983, and James Yates and I, who had been in residency together in Charleston, formed Coastal Orthopedic Associates, and now celebrating 28 years of a practice.
Where did you go to medical school?
Did all of my training in South Carolina. I went to the University of South Carolina. I'm a Gamecock. And then medical school in Charleston, my residency in Charleston, and then I did a fellowship in surgery of the hand and microsurgery in Charleston as well.
I also happen to know, Dr. Haskin, that you have been incredibly involved in this hospital.
Well, been here a long time, but I've served as chief of staff and chief of surgery over the years. Very proud of where this hospital has come from and where it is now and where it's going. It's a remarkably vibrant community.
You've also been very involved with a lot of societies and memberships with a lot of groups that specialize in the hand, and you've certainly brought some great credibility to this community in regards to the hand.
Well, thank you. I'm a member of, particularly proud of an organization called the Southeastern Hand Society, or Southeastern Hand Club. There are 3 hand surgeons in South Carolina that were invited to join, and I'm one of those. And it's a small group of hand surgeons from around the Southeast. We get together once a year and look at problem cases and new techniques. I'm proud to have been president of that organization back in 2005. So.
You told me that you wanted to talk a little bit today about some of the conditions of the hand, and one of the most common conditions is known as carpal tunnel syndrome. What exactly is that?
It's unbelievably common. Carpal tunnel syndrome is a condition in which the median nerve in your hand or in your wrist is compressed. The median nerve is a nerve that gives you the feeling in these 3 fingers. And the most common complaints we see is particularly common in women, and it typically is one in which they begin to notice that they wake up at night with their hand burning and tingling, and they have to exercise or run it under cold water, and then it goes away. And then as it progresses, it becomes a problem of when they drive a car, talk on a cell phone, their hand goes numb, aching, pain, and it's unbelievably common. We don't really know the cause of it. A few years ago, people were thinking it was related to what was called repetitive activities, which really has nothing to do with it, we've come to find out. And we do a lot of surgery for it. It's almost totally curable by surgery, barring any complications. I do about 250 carpal tunnel operations every year. It's very, very common. If I can use this hand model to show, it's an outpatient operation. You don't go to sleep. We just numb up your arm, come in, have surgery, and go home. And this ligament right here, called the transverse flexor retinaculum, is opened. And it basically is taking a confined space and take the pressure off, just undo the pressure, and it dramatically relieves the symptoms. And it doesn't usually come back. And most people are back doing their normal activities within a couple of 3 weeks. A little soreness, but we've had some of our nursing staff that have had the operation and are back at work in a day or 2, just can't lift anything heavy until the sutures come out.
Have we ever figured out, though, why very few men ever have carpal tunnel syndrome?
We don't know, but it is remarkably more common in women than men. A lot of men have it, but not as many as women.
Mm-hmm. We're going to take a break, but when we come back, we're going to continue our conversations about the hand with Dr. Stewart Haskin. Do stay with us.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
Continuing now with Dr. Stewart Haskin of Coastal Orthopedics. We were talking about carpal tunnel syndrome, but we continue now by talking about hand surgery and other areas for that matter. Let's talk a little bit about some of the other things that you do other than carpal tunnel syndrome.
Probably some of the more common things we see are fractures of the fingers, the hand, the wrist. And I brought in some models today to show a relatively new way of treating wrist fractures that's very different from when I first came to Conway and first started doing orthopedics. Someone developed, in fact, a friend of mine developed a plate to fix fractures of the wrist. This is the radius bone, look right there. And this is a very common site of fractures, particularly as we get older. And back in the day, so to speak, we had limited ways to be able to fix these fractures. But this technique now allows us to stabilize these fractures. It's now outpatient surgery, a cast for maybe 10 days to 2 weeks, and then a removable cast after that. So your recovery is dramatically improved, and the functional outcome is dramatically improved as well. Without this technology, we would still be treating it much differently than we do now.
And what is this piece?
These are similar, just different manufacturers, the same plate, but the acrylic one allows you to see where the screws go, how they kind of go through the bone, and stabilize all the different fragments.
In your years as an orthopedist, what has been one of the most amazing things that's happened in the way of technology that you probably never thought you'd ever see?
Probably the minimally invasive approaches to some of the surgical procedures we do, the arthroscopic or endoscopic procedures we do. Everyone knows about arthroscopic surgery of the shoulder and the knee, but we also do arthroscopic surgery in the hand, particularly the wrist. I think I was one of the first surgeons in the state of South Carolina to do arthroscopic surgery of the wrist back in 1986. But the instruments we use now are drastically different. Just the improvement in the technology and the imaging systems over the last 20 years has been pretty dramatic.
It's something that amazes me is the fact that people go in now for hip replacements and they're in and out so fast.
Oh my gosh, yeah. This hip replacement surgery is sometimes an overnight or a 2-night stay, where years ago, even a decade ago, it would be a week in the hospital. But the newer techniques in pain management, newer techniques in anesthesia, newer techniques in nursing care and therapy have all just made this quite possible.
Let's talk about the various doctors that you have at Coastal Orthopedics, because all of you specialize in different parts of the body.
Right, right. This technology that is driving our specialty is also somewhat fragmenting our specialty, because you just can't know everything about everything. And so within orthopedics, they have developed subspecialties in orthopedics, and within our practice, we have a spine surgeon, we have a specialist in sports medicine, we have a specialist in joint replacement. I do hand and upper extremity. We have a foot and ankle specialist. And then within our practice, a little bit unusual, because we're not just orthopedics, we're really musculoskeletal, in that we have 2 physical medicine and rehabilitation specialists, or PM&R, who are non-operative bone and joint care, so to speak. Dr. Aaron Watson and Dr. Jeff Wilkins, they do pain management, conservative care, back pain, neck pain. We have our own interventional pain center at our office where Dr. Watson performs certain pain blocks, pain procedures. They also do electrodiagnostic studies, nerve conduction studies that we use to diagnose carpal tunnel syndrome that we talked about earlier.
So you actually cover the whole body.
We do, head to toe.
And the spirit as well.
Thank you.
Dr. Haskin, thank you so much for being with us
Thank you,
here.
Diane.
And best wishes to you in the days ahead with
Thank you.
Coastal Orthopedics.
Thank you very much.